Okay, hi everyone. I'm Alexis Williams, co-founder of Business Skills for Health Professionals, and welcome to the podcast Beyond Clinical. In this podcast, I'll be interviewing health professionals from diverse backgrounds who've moved into unconventional roles beyond clinical. I'll be sharing their stories and tips and hope that this inspires you to pursue unique career paths. So this is episode 20 of the podcast, and it's the last episode of season one. I'd like to introduce my guest, Jennifer Fiske. Jennifer, do you want to say hello to everyone?
Hi, everybody. Hopefully, I have something insightful to share with you today.
Oh, I'm sure you will. I've had a lot of people interested in the area that you're working in, so I'm super excited. But I'm going to share a little bit about your background. And you're in Texas, right? So I know that's
Yes.
kind of unique. I have a good mix of like US and Canadian and international listeners. So yeah, that's kind of fun. So yeah, let me read your bio and get to know you a little bit. So Jennifer is a registered dietitian nutritionist with a dynamic background and wealth of experience. She has worked with youth and adult elite athletes to improve athletic performance, including a professional sports team. As a clinical dietitian, she collaborated with peers to improve the quality of evidence-based practices and patient care. Jenn was the first health education coordinator at Dallas-Fort Worth Airport's LiveWell program, where she coached clients for improved job performance, disease management, and quality of life. She built custom programs for employee resource groups and crafted communications for airport-wide media. As the wellness coordinator for the Frisco Independent School District, Jenn opened on-site and virtual health clinics that provide acute care at no cost to employees. She gave tailored nutrition presentations to employees and high school athletes, established mobile mammography, and educated about employee resources, including coaching, financial, and mental well-being programs. Jenn currently works in product management and supports her community with nutrition and wellness expertise. I'm super excited to have you. I've had a lot of people really interested in like some of the areas that you're working in. So yeah, I want to start out with a fun question. What's something that a health and wellness trend that you are personally into right now?
Ooh, I would say probably plant-based, which like plant-based eating, I feel like it has waxed and waned quite a bit over the last few years. When I worked at the airport, they were actually a Blue Zone certified workplace. So we did a lot of like
Ooh.
um, putting plants, on your plate. And I do see that that always comes and goes, especially where I live in Dallas. We have quite a mixture of, um, I guess you could say we're truly like a melting pot. That might be a better way
Hmm.
to put that. So we have such a diverse group of eaters. So a lot of vegetarians, there's a lot of like Indian and Asian influence. So finding ways to include that for those of us that grew up in the United States and plants were, like vegetables and not so much a protein is
Hmm.
definitely something I'm trying to include more at my own household. Because I think it's just such a great trend and it's so healthy for everyone.
Yeah. Do you have a favorite plant-based protein that you're into right now?
Yes, I love Trader Joe's steamed lentils.
Ooh.
Um, yeah, they come like vacuum sealed and uh I love just tossing them like on a salad, hot or cold, or mixing them into something. And even my son, who's 4, a little seasoning, and he'll usually eat them. So that's definitely my affordable favorite.
That's awesome. I know all my Canadian listeners are very envious of Trader Joe's. We don't have it here yet. I don't know if it'll ever come here, but yeah, they have so many great products. It's like every dietitian I know who goes into the States like is always talking about their Trader Joe's haul that they come back with. So
They're new
yeah.
to me.
Oh,
So
okay.
yes,
Oh,
mostly they're just so affordable, and that's one of the things I love.
yeah.
So,
Yeah. My favorite right now is smoked tofu. I just discovered
ooh.
smoked tofu as like a sandwich topping, and I've been grilling it and just like putting it on sandwiches instead of ham or turkey, like deli meats. And I'm loving that. It's so easy too. You just like slice it and pan fry it and it's ready to go. So yeah, I love the plant-based eating movement for sure. Yeah, I'd love to hear a little bit more from in your words about your career journey. I know I talked about it a little bit in your bio. Yeah, can you tell us a little bit about it?
Sure. So way back when, seems like a lifetime ago, I was originally a chemistry major in college. And then after my freshman year, I thought, okay, I love this, but what do I do with a degree in chemistry? You are expected to like go to med school or pharmacy, and I just wanted to have extra options. So I switched to nutrition, and I ended up volunteering for the local food bank
Mm,
and eventually took over their backpack program when the previous student graduated. So that was really my entry into like nutrition. And ironically, it was very anti like becoming a dietitian because I didn't want to work in a hospital. Like I loved medicine, but um I fell in love with just like the many ways you can support people with food. And eventually, when I moved to Dallas after I graduated, I went to work for a charter school system in their child nutrition department. And the school district actually served primarily lower socioeconomic areas all over DFW. So I really got to apply the knowledge and the skills I gained in undergrad while I started grad school. I did not match to an internship right away. It actually took me 3 times to match. So for anybody that's like, oh, I didn't make it in, the timing will come for you.
yeah.
But I had my eyes set on sports. I love the concept of like athletic performance and fueling for performance. So after I got to a certain point in my first graduate program, we actually had practicums, like 3 semesters of working in an environment, like getting exposure to working with athletes. So I ended up with my third practicum at an MLS team. And right before that, I was actually at a performance training center that worked with athletes at all levels. But I primarily worked with athletes training out of college to get into the NFL. So for their combine and their pro days, and then
Hmm.
some off season. And I ended up staying with the MLS team. I really didn't know anything about soccer. I was a gymnast and I coached, and I had the time with how my internship and grad school all played out. And I just like fell in love with it. I loved that it was using my medical nutrition therapy, but it was also engaging in that sports science, helping athletes through injuries, recovery. But there was also a lot of business skills in that. I was responsible for manning a sponsorship budget, ordering all of the supplements. I had to create like a business case and advocate for additional funding just to go to like Sam's
Mm.
and buy snacks. And it's kind of like feeding a fraternity in many ways. Like you think you buy enough bananas and the next day you're like, oh my God, who
We're
ate
out.
everything?
Yeah.
Yeah. So all of the like fiduciary responsibilities, the organizing, um, and I thought I would stay in sports long term. The fun thing with sports is everything is cyclical. No coach stays forever. And a lot of times when teams turn over, coaching staff and all of their support staff are part of that. And I left just before a big coaching change, honestly, due to financing.
Mm.
I was like, okay, I'm a dietitian now, and like I have 2 master's degrees. I'm ready to make money. And
Yeah.
they just didn't have it to keep me. So I left and I had no job lined up. And
Scary.
yeah, in hindsight, it's funny, but also it kind of made me rethink like, where do I want to go in my career? And I've always been somebody that's like, let the opportunities come and let's see how it goes. So I hit the road just like every other new grad. At the time, I think I estimated on average there was about 100 brand new dietitians every spring out of the internship programs in my city. So
That's a
not
lot.
competitive at all for jobs, yes.
Yeah.
Um,
Wow.
it spent 3 months going on interviews, and I always got to the final, leg of it only to be told like, "Oh, well, this other person has experience," or, "Oh, this other person's actually a dietitian for longer," even if I had better experience and stronger skills. So I took a PRN clinical job, like literally what everyone says, take this out of internship and just get your feet wet. I actually really enjoyed it because the hospital system and the dietitians I worked with were so supportive. They were so
Mm,
positive. That was a complete 180 from my clinical rotation with adults. So
yeah.
um, I learned NICU, I got to do ICU, I got to work with like case managers and things well beyond what I had done previously, but I needed a full time job with benefits. And I found my first corporate wellness job on LinkedIn.
Oh,
Um,
cool.
yep, at the time, LinkedIn, or no, it might have been Indeed. Indeed back then was a much heavier hitter, I think, in the job like market than it is maybe today.
Hmm.
And it was a brand new role being created by somebody that was leaving. So they thought, we interviewed a dietitian previously and she impressed us. Um, and the only reason I can think that I was selected, I hadn't even been a dietitian 6 months, 8 months at the time, was how I pitched myself in my interview and how I sold my skills from
Mm,
working in professional sports and school nutrition and working at a food bank, even as a student.
yeah,
Um, and from there, I just kind of followed the journey as it went. I'm someone that loves to build programs. I love to think big and make big cases for things. And ultimately, it has all kind of led to where I'm at today. So, no regrets,
that's
crazy
awesome.
journey, but yeah,
Yeah, I think there's so many nuggets in that story, just like your persistence, with internship matching, um, even just like taking a clinical role right out of school. I think a lot of people want to go right into maybe more of a business oriented role. And there's nothing wrong with getting some clinical experience. In fact, I think it adds a lot of value to, even if you never see yourself there, I think it adds a lot of value to your understanding of health and like the systems. I found that, at least I did a lot of like short-term clinical roles in early in my career as well. And I just found like, wow, I really understand the way things work through that experience. And it helped me when I went into more of like program development roles. So I love that. And yeah, I think you're right. It is a lot about those interviews and like getting comfortable, drawing on all your experiences, and keeping things top of mind. So I love that. Are there any skills that you've found really transferred well, like throughout your career so far?
for me, the biggest thing is always the person's experience. Whether it's a patient or now I always say like the member experience. And that's where, like you said, that clinical aspect is so important. You have to be willing to put yourself in someone else's shoes and, mentally walk through their journey of what am I doing to make this better? What barriers are they experiencing? And you have to be willing to advocate for that. Um, whether it's as a clinician, whether it's in corporate wellness, saying, hey, we have a large number of people with diabetes or prediabetes. What are we doing to address that? And then also, to your point, you have to be willing to speak to the clinical outcomes, the science behind what you're doing. And that's what makes dietitians so unique is we understand the physiology, we understand the day-to-day implications. How does food come into all of this? How do we support from, an exercise physiology point of view, their ability to perform their activities of daily living and fueling that.
Mhm.
So for me, keeping that experience in mind helps me tell the story of how I can improve that person's life in any way.
Mm.
And you have to say it with confidence. We
Mm-hmm.
don't get enough of that in school, I think, is stepping up and saying, you know, I can do this. I know more than nutrition. My
Mm-hmm.
skills that I've gained in advocating for individuals, studying products or, programs, those are things that dietitians know. We just assume that other people know it too, and they don't. You have to be willing to tell them.
Yeah. Was there anything that really helped you grow your confidence in that area, or did it come more naturally to you?
I hate to say age.
Yes.
Age definitely helps that. Um, Becoming a mom also helps that. I say, I recently spoke. I as like a side hobby, I write for a mom's blog. Like I'm one of the
Mhm.
contributors for it. And I think being a mom makes you answer uh address situations that you're like, I have to do this. Like there's another option. I have to make a decision. And that eventually kind
Mm.
of carries over. But experience is just a big one. The more you end up in situations where you have to speak up,
Mhm.
um, or you have to go to bat for yourself or for others, but also the knowledge. I had
Mhm.
no idea what I didn't know about corporate wellness until I was a few years in, which I
Mhm.
think is pretty common.
Yeah. Yeah. I think it's like that learning on the job, right? Like all the things you experience when you're new to a role, especially about like different environments and how, like, what is their business model? I always talk about that with my coaching clients is like when you're interviewing, like get to know what that company's all about. What is their actual like business model? Because that's going to really set you apart from maybe somebody else who's interviewing that doesn't actually know what they're all about and how they operate. So I agree there.
Yes.
I also thought it
Those
was really
interviews,
interesting. Oh, go ahead.
I would say those interviews are two-way streets, and I don't think
Hmm.
that's emphasized enough. Um, I'm somebody like by nature, I have to know things. So I will dig super deep to learn things. And having been on the other side of that interview table several times, it really makes a difference if you do your homework. You don't want to come off like you've been stalking people, but you have to be able to speak to what is readily available. That's
Hmm.
expected. But you also have to know that as much as someone is considering you for a job, you have to consider what that job looks like in your day to day life. And sometimes it's not a fit. I actually
Hmm.
turned down 3 jobs before I took my job at the school district. One was going back into sports, and I wanted the job like so badly. The timing was just not right with some like family events. But you have to know that sometimes your gut feeling is going to say, this sounds awesome, but it's not right. And that's okay. There's something
Hmm.
else on the horizon.
Yeah, for sure. Another thing I thought you found really interesting about what you said was really that utilization of the empathy skills, like putting yourself in the shoes. And that can apply in more like clinical roles, but also in business roles, because a lot of marketing is around like solving problems and creating programs and services to meet customer need. So I think there's a lot of transferability in that empathy skill. So I love that you touched on that one. Can you talk a little bit about networking and how that has played out throughout your career, both kind of networking within your companies and outside?
Yep. So this is a funny one for me. By nature, I'm a very big introvert. I'm very much
Mm.
the like recharge at home with a book, just hang out in public, like for work. I will network with anybody. At the end of the day, everybody's a person, and so are you. And I always remind myself that they might have a big title or a big salary and a lot of influence. They're also a person. So that like helps take them
Yeah.
down to like, a little nervousness, but networking is so worth it. And most people are very happy to talk to you. If you reach out, try not to monopolize their time. I think it's better to have a follow up than to, talk
Yeah.
someone's ear off. But I have never found an issue with somebody saying, I don't want to talk to you, or no, I can't answer that. Um, Especially in the dietitian and in the wellness world, they're very small circles.
Hmm.
So the more you can get to know people, figure out what their company does, ask about what is your journey, what extra, certifications did you take? People love to talk about that kind of stuff because ultimately we all do better when we're all succeeding as a team, is how I see it.
Mhm. Yeah, that's so valuable. I think just like not being afraid to reach out and connect with people and ask for a small amount of their time and make it convenient for them. Um, and yeah, just learn more about their journey. I think there's a lot of value in that. So thank you for sharing that. What did you find like was the biggest maybe gap that you had to learn about when you went from more of like traditional dietitian roles into some of the business environments that you're in today?
I would say benefits was the first one, and technology in terms of like IT setups is definitely the second one. In terms of benefits, that's where you think working in a clinical setting, but then really getting to know your colleagues, like your case managers and your nurse team, your nurse leadership, they can really help you learn a lot. Um, I ironically shared an office with the case manager and the social worker when I worked in clinical. So I got to overhear a lot of discharge planning and coordinating this and that and approvals. And um, then when I got into corporate wellness, it's not just you have a high deductible plan or a PPO or an HMO. It goes so much beyond that. And it's something that most people, I think, learn as they go. The only way I can imagine somebody would have better insight out of school is if they have a degree in HR, like
Hmm.
human resources. But I found that most people learn benefits by getting into a benefits job.
Hmm.
So, um, for individuals that are trying to get into corporate wellness and don't know where to start, I always say, like, learn the basics of
Hmm.
what benefits plans, especially here in the United States, can look like. If you can, look up the company online and see if you can find their benefits guide. Not everyone's is public, but you can usually
Hmm.
find something. Um, Understand the language of what is a copay versus a deductible, cost
Hmm.
sharing, what is an HSA versus an HCA. You know, that's step one. From there, you'll build and learn. And one of the things that I started last year was a CEBS credential, Certified Employee Benefit Specialist. I'm a little over halfway through. It's 5 modules, and it's very intense. Um,
Hmm.
but I learned so much, even in areas that I already knew well, like what's actually in, you know, for us, like Social Security. How does Medicare work, like on a more refined level? Global benefits, but you don't have to do a whole certification. You can absolutely go online and learn. It's a steep learning curve, though. It really is, and the
Hmm.
language is just something next level, and everyone speaks it a little differently.
Yeah, I can't agree more though that if you want to work in corporate wellness, that's such a invaluable too. I think a lot of people think something different about corporate wellness from the outside when they're maybe coming at it more from a health background, but there is a huge HR component. It usually falls under HR. My partner works in HR, so I was a little bit lucky to have him to bounce like things off of over the years about HR and benefits. But I totally agree. It's a learning curve, and there's a lot of value if you want to work in that space, learning about it, and also even like understanding like disability management and some of those other aspects that fall under wellness. Like sometimes things like health and safety are included in those roles, which is
Yep.
quite different background than what you might have coming at it from like a food nutrition wellness angle. So I love that. I think there's so much value that we can add to that area as dietitians. What do you love most about what you're doing now?
Oh, so I can't say a whole lot, just how like we're set up, but honestly, I love the team that I work with. And that sounds super cliche. Um, but in the past, I very much thought like I'm a strong individual. I can do this, on my own. Sometimes I was a one person team. but I have a counterpart now, and she's amazing. Um,
Hmm.
I love the another cliche word, the synergy that we have, but I
Hmm.
love how we collaborate together. I love the team that I work on. And I love that my company, even for being the type of company that it is, which often gets a bad reputation, we very much have a member first, um, North Star. That is
Hmm.
underneath everything. How are we caring for our members? What is their journey? How are we supporting our community? Volunteering is not optional for us.
Hmm.
It's expected, and I love that. I want
Hmm.
us to have that 360, support for our communities, um, at all levels. So for me, that really makes my job enjoyable. It makes the stressful days like, you know what, we're doing this for other people and I'm supporting people on a very large scale. Whereas
Hmm.
in the past, it was much more individual or small group.
Yeah, I think that comment you made about the North Star is so important to any health professional who's thinking about getting into something unique and maybe outside of clinical is finding companies that you can really get behind the bigger picture of what they're doing and see that the why and the North Star. I think it is really important because we are wired, and that's why we went into the fields often. We're wired to want to have an impact on people's lives. So I think that's really important for when you're considering like different opportunities that are out there. Um,
Yes.
you mentioned your CEBS. Is there anything else you're working on right now with like professional development for your own growth? That sounds like a big
I
one.
I so I'm a big book reader. So currently my goal is to alternate like leisure book, professional development book. I
Mm,
work with a lot of people that went to business school. There's a lot of MBAs,
yeah.
and I did not. Both of my degrees are one is in sports science and exercise science. The other was a clinical master's tied to my internship. So I try to alternate things that fill in some of those gaps, but also I still have 2 parts of my CEBS left. So once I get through that, I'm gonna focus on some, thankfully, we have some tuition reimbursement, so investing in more courses on data analysis and
Hmm.
different types of technology, because there's definitely platforms that we utilize that are still new to me, and I want to be a better steward of their capabilities. That helps me do my job better. It helps me tell a value story better. And I've had statistics, but true data analysis is goes pretty deep. So that's next on my list.
Yeah, it is a different angle than we might think of from like the health research and those kind of statistics, the like more the data analytics and like business intelligence side of things. I think that's something that it's like a whole other area to learn about. So yeah, I definitely see a lot of value in that. If there was something that you could share with your early career self, so maybe when you were going back to like the end of internship, what would that be?
Ooh. Ironically, I was one of the older interns in my class. And I say that tongue in cheek because I was still in my 20s, but I was not fresh out of undergrad. Um, and I think I was at a point where I could look around and really just try and soak in everything. Um, of course, I was like married, so I wasn't like trying to pay my rent by myself, which helped. But I would say just continue to be confident in what you can bring to the table, knowing that no job expects you to walk in the door and know everything. You will always learn and you'll always evolve when you get there. What you bring is your confidence and your ability to problem solve.
Hmm. Absolutely. Yeah, skills, a lot of skills and information can be learned easily, but that ability to learn is something that, you kind of do get through your education as a health professional. So I love that one. Any final advice that you want to give the listeners before I wrap up?
I would say especially in the business world and wellness, which you called it, it's always under HR or risk management, or sometimes those are like together. Um, Being a dietitian is such an asset. A lot of times I have felt that people thought that all I knew was nutrition, and it can be hard to swallow that you know things in other areas, but there are other degrees that might provide a more holistic background. And you don't have to fill those gaps. You just have to be resourceful.
Mm-hmm.
But don't don't downplay how valuable being a dietitian is, and think through how you mentally operate when you support patients or when you run a program, because that is your that's your sales pitch right there. How do you get from
Mm-hmm.
A to B? And being a dietitian is one of the few health, professions where you can be your own business. You don't have to
Mm-hmm.
work under somebody, and really the sky's the limit. If you like
Mm-hmm.
marketing, look for a marketing job at a company that does food or
Mm-hmm.
supplements. If you like data science, look for roles that are, healthcare facing. You can really do anything, but there aren't that many dietitians. I work with a ton of nurses and
Mm-hmm.
physicians, and they seem shiny, but so are we. So,
I love that.
yeah, be
Yeah.
proud of that.
Yeah, there's a lot of value in what you said there, just around like realizing what we learn maybe as dietitians and some other health professions, like how that impacts just wellness as a whole, I think can be so valuable in some of these different sectors. So thank you for sharing that. All right. Well, I'm going to wrap up and then we'll sign off. So I hope everyone enjoyed hearing from Jennifer and you're feeling inspired. If you want to engage more with my community, please join the Facebook group or the LinkedIn group. I'll link them both in the show notes. It's called Business Skills for Health Professionals Community. I also have two exciting ways to help you. If you're wanting to make a career transition into something new, I have a career transition program. And if you're already working in a setting outside of clinical, we have a newly launched network and membership where we meet monthly to kind of navigate things in the business world and help each other out. And you can find out more about both of these by visiting the links in the show notes. So thank you so much, Jennifer, for all your insights. And yeah, I'm signing off for season 1. So hope everyone has enjoyed all the different guests we've had. It's been super exciting hearing stories. All right. Thank you.